Good morning, guys. It is awesome to be here again. This video is about the basic things you need to know as a medical student or a health science student in renal physiology. It was compiled by me, Charlie, your uncle, your facilitator, your coach, and I will be presiding for this course or presiding over this course. For you to become a professional medical doctor or a pharmacist or a medical lab scientist or a physiologist or anatomist or a dentist or optometrist and so on, renal physiology is one of the courses you will do in medical school. All right. If you miss doing this course in medical school, it means that your training or your foundation is faulty. You will not graduate as a medical doctor. Rather, you will be graduating as a professional native doctor. Yeah, you had me right. A herbalist. Yeah, I mean, you can't afford spending all the years in medical school and you end up missing herbs and chanting incantations and yanking down evil spirits for your village people. No, God forbid. Say God forbid. That's not what I want for you. Okay. Going forward, what is renal physiology? Renal physiology is concerned with the structure and functions of the kidney. Yup, it's about the human kidney. And to make things very simple, I would like to categorize the topics in renal physiology into modules. Alright, so in module 1, I'll discuss the microscopic structure of the kidney. That is known as the nephron. Alright, in module 2, I will discuss the physiologic roles of the human kidney. Module 3 will be on urine formation. Because many times we go to the components to pass out urine, but we don't know how the urine is formed. That will be discussed in module 3. In module 4, I'll be teaching you glomerular filtration rates, the meaning, the normal values, and everything about glomerular filtration rate. In module 5, I'll be discussing clearance techniques. Clearance techniques is concerned with measurement of glomerular filtration rate, renal blood flow, renal plasma flow, and so on. And I'll be showing you the formulas used in calculating all of that. In module 6, will be on urine concentration and dilution. Very important topic. Yeah, you see, every now and then we go to the convenience. Sometimes we pass out very small amount of urine. Other times you may pass out a very large volume of urine. Why does this happen? It is not the oracle in your village controlling that. It is the kidney, your kidney. Yes, that is what I'll be showing you in module 6, urine concentration and dilution. In module 7, I'll be teaching micturition, how the urine formed in the human body is voided out to the exterior. Alright, and then finally module 8, we'll be discussing some renal dysfunctions, renal disorders such as the Bartter syndrome, diabetes insipidus, and a whole lot of that. Okay, all right, going forward, the materials you will need. Some materials for this course. The first thing you will need is a notebook, not a paper or a jotter. You know, from my experience in building medics, I discovered that most students write on a piece of paper, and before you know it, they use it to clean their bum in the convenience. Please, for this course, you don't need piece of paper or a jotter. Get yourself 80 leaves notebook. and a pen, very important, and a data. You also need data to, I mean, download subsequent videos in this topics I'll be teaching you in this course. Alright, so you need data, very important. Also, please make sure you make notes while my lecture is going on. I encourage students to make notes as I teach, just like the young man displayed on your screen. You can see he's a very serious student. I believe he maybe he's watching one of my online videos. He's not watching Z World or Arsenal of mine. It must be one of my online videos. So you must be serious. You must be serious for you to succeed in the medical school, for you to become a professional medical doctor, a professional pharmacist, an optometrist, a medical lab scientist, a registered and a trained professional nurse. You must be serious. Okay. All right. All right. Module 1. Module 1 will be on the microscopic structure of the nephron. Remember I told you that renal physiology deals with the structure and the functions of the human kidney. But for this course, I'll be focusing on the microscopic structure of the kidney. Okay, and that is called the nephron. Right? We'll look at what a nephron is, the meaning of a nephron, or the parts of a nephron. We'll make a rough sketch of the nephron, what it looks like, and we're going to explain or describe the various parts of the nephron, and then we'll classify nephrons into the various types. Alright? Okay. Ready? Yeah, alright. A nephron. A nephron can be defined as the basic structural and functional unit of the kidney. Just like the cell is defined or is known as the structural and functional unit of every living thing. The nephron is the building block of the kidney. There are about 1.2 million nephrons in each kidney. It means that your kidney, one of your kidney, contains 1.2 million nephrons. This implies that both kidneys would have 2.4 million nephrons. This is the nephron count. The nephron count is basically 2.4 million. Nephron count can reduce due to mutations, gene mutations, diseases, environmental toxins, and reduction in the nephron count is the reason why people develop a whole lot of renal dysfunctions such as kidney failure. Even it reduced, the nephron count can also reduce as a result of age. We shall come to all of that in the subsequent lessons. Parts of the nephron. The human nephron is made up of the following parts. First is the renal corpuscle. The renal corpuscle is made up of two distinct parts, which includes the glomerulus and the Bowman's capsule. The next part that forms a nephron is the renal tubules. The renal tubes is made up of proximal convoluted tubule, that's the PCT. It is also made up of loops of Henle. It's made up of distal convoluted tubule, and lastly the collecting ducts. We are going to look at the meaning and the physiology of each and every component of the nephron in this lecture. Okay, what does a nephron look like? I'll make a rough sketch of the human nephron, because many a times I've seen students drawing a neuron in place of a nephron. Sometimes in professional exams like second MBBS, we ask students, please sketch a nephron, and they draw a neuron in place of a nephron. So it's important that you learn how to draw the structure of a nephron. A human nephron looks like this anatomically. It's made up of the glomerulus. Glomerulus is actually formed by clusters of capillaries. We shall come to that. Okay, and it is enclosed by a cup-like structure known as the Bowman's capsule, as earlier mentioned. Alright, so I'll just label the parts. This is the glomerulus. Okay, the glomerulus. Alright, and this part is the what? The Bowman's capsule. This is the Bowman's capsule. It's very important that you know how to draw the nephron. Very important. The Bowman's capsule. Oh, I beg your pardon. This is A. The Bowman's capsule. Okay? Capsule. I hope I'm correct. Okay, going forward, you can recall that just a minute, the Bowman's capsule and the glomerulus are together known as the renal corpuscle. Okay, I'm going to label that later on. So from the Bowman's capsule, the PCT arises, and the PCT, from the PCT, the thick descending loop of Henle arises, and then it gives rise to the thin descending loop of Henle. Okay, alright. The hairpin bend connects the descending and the ascending loops of Henle. This is a rough sketch, so don't laugh at me. Okay, so from the hairpin bend, the thin ascending loop of Henle originates, and it further gives rise to the thick ascending loop of Henle. Alright, and from there, the distal convoluted tubule originates. Don't worry, I'm going to label the diagram for you to understand what I'm drawing or sketching. From the distal convoluted tubule, the collecting dots originates, and this collecting dot terminates in the renal pelvis. Alright, fantastic. This is what the nephron looks like. Alright, so let's label them. This part of the nephron is known as the PCT. It's known as the PCT. That is the proximal convoluted tubule, PCT. Alright, this part of the nephron is called the what? It is called the thick. The thick. The thick descending loop of Henle. Right? And this part of the nephron is known as the thin descending loop of Henle. Thin descending loop of Henle. I hope you're following. Okay. And from here to this part, let me just circle it for you to understand what I mean. From this part down to the whole of this part is known as the hairpin bend. The hairpin bend connects what? The descending and the ascending loops of Henle. Okay, so this is the hairpin bend. Alright, good. This other part of the nephron is known as the thin. The thin what? The thin ascending loop of Henle. Okay, and this part is the thick ascending loop of Henle. This part is the thick ascending loop of what? Henle, right? The horizontal part here is known as the DCT. This is known as the distal convoluted tubule, alright? And this part is called the collecting duct. This part is called the collecting duct, CD. Please, CD is not condoms, it is collecting ducts, alright? And the last part is called the renal pelvis. The last part of the nephron is called the renal pelvis. Oh, beautiful, fantastic. Now this is a rough sketch of the human nephron. Alright, like I said earlier on, you might be asked in exam to draw or explain with appropriate diagrams the physiology of a nephron. You could be asked in Viva Voce to draw a nephron, and it's not something you should fear. So I urge every one of you, especially those of you in medicine and surgery, to practice how to draw or sketch a nephron. Very important, because I've seen students drawing neurons in place of a nephron. Right? Okay. Going forward. Going forward. Going forward. Alright, this is a diagram, a clearer diagram of a human nephron. It looks like a snake or a tapeworm. If you have ever seen a snake or a tapeworm before, that is exactly how the human nephron looks like. You can see the glomerulus and the Bowman's capsule forming the renal corpuscle. The renal corpuscle. Okay. So I just want to label this for purpose of clarity. So these two structures forms the what? The two structures there forms the renal corpuscle. Okay. All right. And the whole of this part forms the tubular portion of the nephron. The whole of this part, just want to put them in a circle, forms the renal tubule. Okay, so this part enclosed in a circle forms the renal tubule. Okay. All right. Okay. Wow. All right. Going forward, we shall now look at the different parts of the nephron in details, beginning with the glomerulus. The glomerulus is a cluster of capillaries. Alright, each capillary arises from the afferent arteriole and ends at the efferent arteriole. Where is the afferent arteriole? Let me show you. This part that looks like a horn. One of them is called afferent. This is afferent. Afferent arteriole. And the other part is called the efferent. Efferent arteriole. Okay. Oh, I hope you got that. Anyways, going forward, constriction of the afferent arteriole and dilation of the efferent will increase renal blood flow. Okay, so once this part of the nephron is constricted, if this part of the nephron is constricted, just a minute. If this part of the nephron, this is the afferent arteriole. Remember, afferent. Once it is constricted or occluded, somewhere here, all right, the renal blood flow decreases. That is, the amount of blood entering the kidneys reduces. Okay, good. However, if this part of the nephron is occluded or constricted, and this part of the nephron is dilated, there will be an increase in renal blood flow. All right, so take note of that. Going forward, constriction of the efferent and dilation of afferent arterioles will increase renal blood flow or blood flow to the kidneys. The glomerulus is purely arterial. There are no veins in the glomerulus. They are purely arterial. Okay, the Bowman's capsule is a funnel or cup-like structure that encloses the glomerulus. Functionally, renal corpuscle filters blood, which forms the first phase of urine. So the whole of these parts, their function is to form the blood, or filters blood rather, which forms the first phase of urine. We shall get to know all of this when we get to urine formation. Alright. Okay, that is that. The proximal convoluted tubule is located in the renal cortex. I will explain that later on. It originates from the Bowman's capsule. That means it takes its origin from here. The Bowman's capsule. From this part. From this part to this part is actually the PCT. Okay, so it takes its origin from the Bowman's capsule and it terminates at the loop of Henle. Okay, alright, that is the descending loop of Henle. Thick descending loop of Henle. That is where it ends. It is actually permeable to both water and solids. This part of the nephron is permeable to both water and solids. It means that water can leave this part of the nephron freely, and solids can also do the same. So this part of the nephron is both permeable to water and solids. The loop of Henle is made up of three distinct parts. The first part is the descending loop of Henle. The second part is the hairpin bend, and the third part is the ascending loop of Henle. Just for clarity, this part, the cycled part, forms the descending loop of Henle. Okay, all right. This part forms the hairpin bend. The hairpin bend, like I said earlier on, connects the descending loop of Henle and the ascending loop of Henle. Okay, and this other part, I need to use a different color, yellow. Good. This other part forms the ascending loop of Henle. The shaded portion forms the ascending loop of Henle. Okay, all right. Going forward, the descending loop of Henle has two subdivisions. The first one is the thick descending loop of Henle. It originates at the end of the proximal convoluted tubule and terminates at the beginning of the thin descending loop of Henle. The other part is the thin descending loop of Henle. This part of the nephron takes its origin from the end, or at the end of the thick descending loop of Henle, and it terminates at the hairpin bend. The descending loop of Henle is permeable to only water. It therefore means water can diffuse out of this part of the nephron freely, but solutes cannot. Okay, just to demonstrate the descending loop of Henle, like I said earlier on, from here to here forms the thick descending loop of Henle. Okay, while from here down to this part forms the thin descending loop of Henle. Fantastic. All right, descending loop of Henle is known as the concentrating segment of the nephron. We shall explain this better when we get to urine concentration, so keep an eye for that lecture. The hairpin bend forms a connection, or the connection between the descending loop of Henle and the ascending loop of Henle. You already know the location of the hairpin bend. Alright, the ascending loop of Henle also has two subdivisions. Thin ascending loop of Henle, which originates from the end of the hairpin bend and terminates in the thick ascending loop of Henle. The other part is the thick ascending loop of Henle, which takes its origin from the end of the thin ascending loop of Henle and terminates at the distal convoluted tubule. Its permeability. It is permeable to solutes. It simply means that the ascending loop of Henle allows solutes to move out and in freely, but does not allow water to diffuse out of it. Hence, the ascending loop of Henle is always known as the diluting segment of the nephron. I will explain this when we get to urine formation. Do I have to show you the location of the ascending loop of Henle? Alright, I had someone said yes, sir. Okay. Oh, this is the thin ascending loop of Henle, and the thick ascending loop of Henle is this other part, occupies this other part of the nephron. Alright, okay, going forward, the distal convoluted tubule. The distal convoluted tubule is located at the renal cortex. It takes its origin from the end of the thick ascending loop of Henle. The thick ascending loop of Henle, that is from here, the end of the thick ascending loop of Henle, and it terminates at the collecting ducts. That's from this part to this part. Forms from this part down to this part. I've demonstrated this earlier on in this lecture. Alright, this part forms the distal convoluted tubule. So it takes its origin from the end of the thick ascending loop of Henle and terminates at the collecting duct. Going forward, it is permeable to solutes and not water. It means that solutes can diffuse out of the distal convoluted tubules, but water cannot. The collecting duct is located in the renal cortex and the renal medulla. It takes its origin at the end, from the end of the distal convoluted tubule, and terminates in the renal pelvis. Its permeability depends on the action of two hormones. The first hormone is vasopressin, and the next hormone is aldosterone. These two hormones regulate the permeability of water and solutes in the collecting duct. So the permeability depends on the presence or absence of these two hormones. If vasopressin is present, it therefore means that the collecting duct will become impermeable to water, but permeable to solids. But in the absence of vasopressin, the collecting duct becomes water permeable. That is, water can diffuse out of it, but solute cannot. Solute is retained right there on the collecting duct. Okay. Classification, so types of neurons. Basically, there are two major types of nephrons. The first one is the cortical nephrons, and the second is the juxtamedullary nephrons. Differences between the cortical and the juxtamedullary nephrons is displayed on the table you are seeing on your screen. For the cortical nephrons, it constitutes 85% of nephrons, while the juxtamedullary nephrons constitutes only 15% of nephron. Cortical nephrons located in the renal medulla, while juxta is located in the renal medulla. The cortical nephron has short loop of Henle, whereas the juxtamedullary nephrons have long loops of Henle. Wow. The cortical nephrons is supplied by the peritubular capillary, while juxtamedullary nephron is supplied by a type of capillary known as the vasa recta. Okay, what are their functions? Cortical nephrons are specifically important in the formation of urine, whereas the juxtamedullary nephrons are specifically concerned with urine concentration and dilution. Okay, all right. We have come to the end of today's lecture, and normally I give quiz or assignments after my classes or lectures. So I'll just give you a little quiz to do. The first one is dash is the diluting segment of a nephron. So you just fill in the gap. Dash is the diluting segment of a nephron. Number 2, which part of the nephron is permeable to solutes? I mentioned that in this class, so if you find it very difficult to answer these questions, it simply means that your village people do not want you to succeed in your career. That was just a joke. Okay, number 3, explain the action of vasopressin and aldosterone on the collecting ducts. Number 4, with appropriate diagram, write an article on the physiology of a nephron. Okay, these 4 questions should be submitted just before the next class. Okay, you can send your answers to my WhatsApp, and it will be marked and graded accordingly. Up next, okay, our next lecture will be on the physiologic roles of the kidney. Thank you, and see you in the next class. Bye.